Hello, everyone. Welcome. My name is Kate Sample. I am a licensed professional counselor and also an acquisitions editor for Pesci Publishing. And I'm so excited to join you all today. We have Dr. Kate Truitt here. She is a licensed clinical psychologist and also a certified Havening trainer and the global director of research and curriculum development, and also a brand new Pesci author of her forthcoming book. So we're very, very excited to have you here, Kate. Thank you so much.
Oh, thank you, Kate. It's a joy to be here. Thank you.
Yeah, a couple of Kates here today. So we're here to talk about havening, and I know you mentioned backstage that there's quite a havening community out there. So I'm guessing that a lot of your colleagues and friends will be joining us today, but there's also going to be hopefully a lot of people who are curious about havening. So let's just kick it off. Can you tell us a little bit about what are havening techniques and how do they develop? Give us kind of that backstory.
Yeah, so the havening techniques are unique in that they're a therapeutic or an intervention that's a tool. They're not an entire philosophy such as internal family systems or EMDR. And that really makes an incredible space for us to support mental health treatment, in that we're adjunctive, we're a bolt-on or an add-on that empowers the work everybody's doing, which came from a investigation that started over 20 years ago into why does EMDR or why does tapping work? And that question was posed to two doctors who are twin brothers. They live back in New York City, who were just really phenomenally curious individuals, and just wanted to learn and explore. And so their curiosity took them into a deep dive of the neuroscience behind what we call psychosensory techniques, or modalities that use sensory information to change the way the brain is processing. And through that investigation, they identified these really clear links between the use of touch, and we'll talk about the havening touch, and different cognitive protocols to create a specific electrochemical experience in the brain that links into the amygdala and the hippocampus and other brain parts to create change. And so that's where it is a great bolt-on, because so many of these other modalities are working in a thinking brain or a little more downstream. And here we're going, let's get down to that primal core part that has a lot of influence so that all the other modalities are even more effective.
Yeah. So if I'm hearing you correctly, it's similar to tapping, EFT, anything within that realm. Havening techniques are something that you could, as you said, bolt on to trauma treatment or anxiety treatment, really anything at this point. Is it more to soothe the amygdala? When and where would we insert this in treatment if we wanted to?
It soothes the amygdala, and it actually, interestingly, from what we see, actually depotentiates the neurons that have encoded in the brain that are resulting in disturbance or symptoms, the reason clients are coming into our office. And so I like to think of it as a go-to intervention when we're feeling stuck, when we're feeling blocked, when the nervous system's starting to kick up some dust and that good old sympathetic activation's coming on board. And those are indications that there's something that is being acknowledged by our threat brain, our survival brain, and causing us to move into fight, flight, freeze, or fawn, or that more hypo-aroused, depressed state. And so it's just kind of what the brain's linking into and saying survival strategy needed now, when in the present moment, we don't actually need a survival strategy.
Sure, that makes sense. So we were going to kind of talk about this later, but it kind of dovetails into this blog that you wrote on Pesci.com about a tool called CPR for the amygdala. Can you tell us a little bit and kind of show us what that is and how it works?
Absolutely. So one of the things that's really specifically unique about havening is that it has an entire series of self-healing or self-havening protocols that we teach to our patients and our clients to use in between in between sessions. And CPR for the amygdala is one of those interventions. CPR stands for creating personal resilience. And one of the things that's so unique about the amygdala, and I love the amygdala, it's my area of specialization, is that it's deeply involved in, as we know, the 4 Fs that we talk about with the amygdala: fight, flight, freeze, fawn. It's also really involved in all of our emotional states, all the positive and pro-social experiences that we want too. And so CPR for the amygdala is a tool that helps us get out of those freeze or those activated states so that our amygdala can then lean into resilience and personal empowerment.
Mm-hmm.
And so to teach it, we have to do a little bit of background on the havening touch, if I may.
Please, yes.
Okay. So the havening touch involves 4 different areas of activation or engagement, excuse me. The first one, as you just saw me doing, is as though you're washing your hands under warm water. And then something I like to call a havening hug or a moving hug, starting at your shoulders and moving your hands down your arms as though you're giving yourself a nice soothing hug. And then the final 2 are right across your brow. We call this face havening. So if you have a tension headache, you're just kind of rubbing that headache out. And then right underneath the cheeks.
Mm-hmm.
So these 4 areas of engagement activate little tiny receptors that we have in our skin. They're called C-tactile fibers. And they're slow fibers, they're unmyelinated, and they travel up to our brain and engage all of the parts of our brain that are involved when we experience stress or trauma. So we talk a lot about trauma in the body. Well, that's the insula. Talk about a lot about the anterior cingulate gyrus. That's actually one of the areas EMDR targets. Well, that helps us focus and filter what information do we need to pay attention to. And then, of course, our traditional thinking brain, which is all of our cognitive paradigms. These little receptors interact with all those brain parts. And our amygdala has touch-based nuclei that it responds to. So we use the havening touch in a very slow, gentle movement to start to shift the electrochemical activity of the brain. And what we found is it brings on 2 different brainwave states. One's a delta wave state and one's a theta wave state. And so just to give everybody a sense of what that is, if you've ever been really thinking a lot or in a high state of anxiety or activation, it kind of feels like your brain's going really, really fast.
Yeah.
These 2 states are the opposite of that. So we're taking our system into a calm, slow wave state through touch.
Yeah.
Which is really powerful. And it's in our own hands. It doesn't get more accessible than that.
Well, that's what I was just thinking to myself. I mean, this I could do anywhere. And I don't mean to make it sound like a sales pitch. I just feel like this is such an accessible tool for anyone. You know, I do this on my own, I think anyway, something similar, you know, it's fascinating.
Yeah. Well, I don't know how many times I've been on an airplane and seen a mom soothing an upset child by kind of rubbing the face like that. I mean, these are just things that we do. And so CPR for the amygdala and takes these 4 touches. And then another very easy intervention, we start playing brain games. And so that could be humming Old MacDonald, which gets that good old vagus nerve engagement going. I like to do a lot of counting different breaths. So breathe in for 4, out for 6, in for 3, out for 5, so on and so forth. The goal is to give a certain system in our brain called the working memory a different job. And here's the reason why.
Yeah.
Have you ever experienced ruminating? Your brain's just chewing. Yeah, right?
Yeah, absolutely.
When we're ruminating, so ruminating is this kind of cycling process of our thoughts. I like to think of it as though our brain is chewing on something anxiety or worrisome and trying to come to a conclusion, but it's usually about something we don't have a conclusion about.
Correct.
And that involves our working memory looping through anxiety, and our amygdala drives it. So if we give that part of our brain that's trying to solve a problem about worry or anger or frustration or hurt a neutral job, such as counting breath, which of course we like breath, breathing's good for us, playing a brain game while applying the havening touch, it's as though we're telling our amygdala, hey, Amy, here's a warm, fuzzy blanket. And let's bring in some other opportunities for regulation. And by the way, you don't need to worry about that anymore. And when we cut the loop off, she can't talk to that working memory anymore. And we're calming her down. The loop is severed. So it's creating personal resilience. So then we can give her a new job. And we have another protocol. I know we have a blog coming out called Creating Possibilities. Where we say, hey, Amy, what if we went into those other really good feeling states? And we continue to apply that havening touch. And we go, what would I like to feel instead of worried? Oh, maybe strong. And we can start to build into a felt anchored sense of strong with another protocol. It's really exciting. And that's just our healing and our hand stuff. That's not even the clinical work.
Yeah. We're just going to kind of touch the tip of the iceberg with all of this, but I'm reminded of a strategy that I was taught a long time ago when I was in distress. And now it's kind of coming back to me, where it was going through the alphabet in, say, a grocery store, and then naming everything, an item in the grocery store for every letter. And mine was always like avocado, bacon, cilantro. That's how mine always started. I don't know. But I was just thinking that doing that reminds me of what you're saying, that we're asking the working memory to do something else while doing something soothing. And I didn't understand why that worked at the time, but it's coming together for me now that it's working in the inner workings of my amygdala to help send that calming message. Well, the way I thought about it at the time was like putting my worry kind of on a shelf, give it something else to do. But yeah, that makes a lot of sense.
Yeah, distractions have been a longtime favorite of the cognitive behavioral or the cognitive therapeutic process.
Yeah.
And so we're basically taking that and then deepening the impact or the neurobiological shift of those distractions through this electrochemical shift that the touch provides. Yeah. And a little side note bonus, which is one of my favorite things, is when we get triggered, as we say colloquially in the community, and my team and I call those opportunities. And the reason we call it an opportunity is it's our amygdala letting us know that it's thinking there's some sort of threat in the present moment. But Dr. Louis Kozolina reminds us 90% of every moment is defined by our past. So usually a trigger is something from our past showing up right here or right now. And that means there's a little receptor that's coming on board. And by doing the havening touch specifically, and this is where it differs from doing just a brain game without the havening touch, that electrochemical cascade actually depotentiates the receptor that encoded the traumatic or the stressful thing from our past that is showing up in the present moment. And that's a lot of how this works in the clinical space. We take that same opportunity and then we go much deeper into trauma reprocessing.
Right. That's fascinating. As I'm watching you, I can see out of the corner of my eye, we've got lots of questions coming through. I just want to see if there's something that we can jump into. Oh, a nurse. Where can I work? Where can I get more information about havening touch? I want to share this with the nurses I work with. Erica. Thank you, Erica, for the question.
Well, February 25th, we do have a one-day workshop that's coming up with PESI, which is why we're doing this. And we like to share data, which is great. So I would definitely recommend checking that out. It's live and it's on demand. It's a great sale going on right now. And in that workshop, we'll be teaching how to do all the self-healing work, as well as working in different clinical as well as medical environments to integrate havening into your ongoing healing journey. And so that's one option. And then we also have a couple of blogs on PESI. And then I have a YouTube channel, which has hundreds of videos.
Yes.
About how to take this work and bring it into your own self-healing work. And it's a resource we started when the pandemic started and everybody was not having a good time. And so we're like, hey, we've got a tool that people can do. And so we started a channel and it's been great. So a couple resources for you. And then as Kate mentioned, we have a book that'll be coming out pretty shortly that is all about doing your own healing work and working with family members and friends and colleagues to teach them how to do these tools.
Yes, we're hoping for later this year with that book. That'll be wonderful. We're excited to have it out. We're so excited that you're on board. I think we have a couple other questions that came in earlier. We'll see if we can get one of those posted. Go ahead, Kate. If you want to read it, go for it.
Yeah. I'd like to hear about how the havening touch works to calm the mind and the body. So that takes us back to these C tactile fibers that I mentioned before. And the gentle healing touch is engaging, as I mentioned, with these different brain areas. And through that shift in the electrochemical experience of the brain, it's calming it down. I like to think of the havening touch as a version of what breath work does for the heart. that it is doing for the brain.
Sure.
And a little piece that I didn't mention before, when we engage our system and get it into this nice slow wave space, is we have a dump of oxytocin, which is a fabulous hormone that our brain and our body simply absolutely loves. Because that's why we like to touch our friends and our loved ones. We're like, hey, oxytocin, we're relational creatures. We're biologically designed for connection and touch. But we also receive serotonin, and we have an increased presence of GABA. And GABA is a soothing, calming neurochemical that, just a great case study. If somebody's ever taken gabapentin or you've heard of that, people take that for anxiety. This is the internal experience of GABA, and the touch brings forth more GABA. And serotonin, we know from all the, good old depression medications and all those things.
Sure.
So it's this cascade of not just calming the brain down, but also the neurochemicals that help our system downregulate. And the reason havening is called havening is that this combination of variables represents the electrochemical experience of safety in the mind and the body. So by doing this, we're actually cultivating the electrochemical experience of safety.
I love that. It reminds me when we took on your book proposal, when I was sharing it with the team, there was somebody who wasn't familiar with the concept, and he said, havening, like havening? And I was like, yes, like safe haven, and he's like, oh, like, I don't know where he was going with that, but yeah, I was like, no, safe haven is what we're talking about. And you described that beautifully.
Well, and the scientific name is the amygdala depotentiation technique. Because that is what we're doing. We're working with those neurons that have encoded a traumatic experience or that have linked into our brain and our hippocampus and built these deeply painful neural networks of I'm not good enough, I'm not worthy, I'm not lovable. That's another neuroplastic thing called stress-induced structural plasticity. So the havening experience delinks or depotentiates all this, but it's a bit of a mouthful. So havening.
Havening, yes, I think havening is a beautiful way to capture it. How about one more question? It looks like we've got time for.
Right. And yes, there will be a replay of this.
Yes, there will be a replay. Looks like some people are fans of you, Kate. Okay, so why using distraction? Why distraction with the havening touch is what they're asking. How does it affect the nervous system?
So as we were just discussing, it's that bringing in that cognitive piece where we're giving our thinking brain a different job. And when we take this into the clinical space, when we're using havening as a clinical tool, which we'll dive into much, much, much more deeply in the workshop, we're engaging the distractions as both an opportunity for delinking or depotentiating the amygdala. And then we also use them as a wonderful targeting opportunity for developing resources and resiliency, building in a linked sense of competency or confidence. So it's multimodal. And it's basically, I like to think of it as we're bringing our prefrontal cortex on board with intention in a moment of possible stress or anxiety to re-narrate or re-script, or in our traditional mental health terms, build a new schema so that energy has a new job. Or in parts work language, what would a part like to do instead? How would it like to participate and help us stay safe? Well, what if rather than being scared and back on one foot, we felt strong and brave? And we're utilizing the distractions as an opportunity to begin that re-scripting process along with other cognitive frameworks.
Yes. You've explained this, and the comments are saying it too. You're just explaining this so beautifully. And I love that you can, it can be applied to so many different techniques or modalities of therapy. I mean, you just, interwove it with parts work, with CBT. I mean, there's so many different ways. We could probably pull it into DBT and distress tolerance and emotional regulation, mindfulness. I mean, that all just kind of all plays together. I know that we need to go. I just want to ask one quick question, because someone mentioned their son having autism and epilepsy. And it sounds like it would be a really good tool for him, which made me think, are there any places or populations, diagnoses, I don't want to label too hard, but where this would not be indicated? Or it sounds to me like it's something that anyone could benefit from?
Yeah, I'm so glad you brought this up. I was reflecting before our conversation today on this question. And one of the things that I think is really powerful about havening is that it's directly engaging with the single entity that we all have, which is a brain.
Right.
And while we know that different DSM diagnoses have very different neurobiological markers, so OCD is exceptionally different from social anxiety, which is different than generalized anxiety, which is very different from PTSD. What we do know is the amygdala is playing a role in building the schemas, the thoughts, the beliefs, and the considerations, as well as the nervous system interaction with when a symptom shows up. When we witness somebody we love, to the point of the question, having a really hard time, what's happening within our system?
Yeah.
All of those things run through our amygdala. And so while havening may not be the number one treatment for OCD, we know the number one treatment for OCD, right? Exposure prevention. Thank you. My brain just flipped out. We have a wonderful OCD expert on our team. Yes, exposure and response prevention. Thank you.
Yeah,
what we do know is that living with OCD can have a lot of shame, and it can have a lot of personal difficulty. And so we integrate, this is why it's a bolt-on. We integrate the havening into this work to heal the moments that are causing or have encoded the shame, so that that's not strengthening the OCD cycle. Or when people have pain, we know the amygdala plays a huge role in pain and chronic illness. So if we can heal the amygdala to step back, it's no longer influencing the physical manifestation of the symptoms. So that bolt-on piece is really, really amazing. And that's where it's hard to say where it's counterindicated, because we're all humans and we all have hard things.
Mm-hmm.
So that's the opportunity. Now, I want to say one thing about epilepsy. When we do work with a lot of patients who have different neurobiological considerations or traumatic brain injuries, and we always do speak with the neurologist just to make sure that if we are down regulating the system into a delta or a theta wave state, that's okay. We just want to be really mindful. And the different touches have different levels of delta or theta wave engagement. And so we might focus on a slightly lower grade experience rather than go the whole kit and caboodle. If we just are mindful that there might be some sort of electrochemical awareness we need to have.
That makes a lot of sense. I'm glad you said that. To your overall point, that also makes a lot of sense, in that we're all human. We all experience distress of some kind. I don't believe in any kind of hierarchy of pain. So we could all benefit from this added feature, whether we're in treatment or not, right? It's something that it doesn't need to be prescribed. You can do it anytime, and I love that. That's wonderful.
And we have a lot of cardiologists who prescribe it to their patients. It's awesome.
Yeah, it makes a lot of sense. And I'm thinking, we're also editing a book on tapping right now, and I'm thinking of the things I'm reading in there, and it all kind of ties together. It's fascinating work. Yes. Well, thank you so much for being here, Kate. We really appreciate it. As you can see on the bottom of your screen, everyone, we do have a one-day havening training coming up. You can go to pasi.com/havening to see more of Dr. Truitt and learn more about havening, and look for our book later this year. I know we're hopeful that you will come on again, so hopefully we'll see everyone again soon. Thank you so much.
Thank you. It's great spending time with you.
Bye, everybody. Have a great day.